continue with chapter 9. So we're talking about the knee. And let me tell you, the knee specifically is the most important one that we will focus on as an example of the synovial joints. So I will ask you about anything in the knee joint, period, anything. The other joints, I will tell you what I'm expecting you to know. But for the knee, everything. So starting from what are the bones that are making this joint? The femur with the tibia. What exactly? Condyles with condyles, plus the tibia. Fibula does not participate. These are the parts. Inside the joint, I have articular cartilage on the femur, articular cartilage on the tibia. And then I have the patella in the front. I have the synovial cavity. What does it contain? Synovial fluid. It's filled with synovial fluid. And I will tell you why. Plus, you have fat pads to act as a cushion. Plus, you have bursae. What's the bursa? It's a pocket that contains synovial fluid for extra cushion. You have ligaments. You have muscles. Here is one bursa in front of the patella. Here is one bursa here, one bursa there. It's to absorb shock and act as a cushion. You also have specifically in this joint, you have two menisci. Usually, you have one articular cartilage on the end of this bone and one articular cartilage here, smooth. It will make no friction. But here is an extra one because this is the weight-bearing joint. So there is a meniscus, two in between the two bones. And beside all of this, there is also intracapsular ligaments. There are two cruciate ligaments, and cruciate in English means crossing. Inside the joint, you will have two ligaments like this, crossing each other. One crossing from the front and one crossing from the back. Cruciate ligament. Inside the synovial joint, we have the synovial fluid. Why do we have it? It's something like the egg yolk. Why do we have it? Lubrication. It lubricates the joint from inside. It distributes the nutrition. Why? Because if you still remember, I told you guys that cartilage is avascular, no blood vessels. How can you get the nutrition then if it's avascular? From that synovial fluid. Cartilage does not have blood vessels. How you get your oxygen, nutrients, synovial fluid. Shock absorption because it's fluid, so it absorbs the shock. For stabilization, we have all of these cartilages, bursae, tendons, ligaments, and fat pads that I showed you. Menisci is a fibrocartilage specifically. Remember, we talked about the different types of cartilages. This one is fibrocartilages in between the two bones. It's not just those articular bones. This is extra. You also have fat pads, and this is for absorption of shock, act as a cushion, ligaments to strengthen the joints. And we have different ligaments that we will need to know. There is a term here that you will hear, or you might have heard of, which is something called sprain. Sprain have nothing to do with the bone. Sprain means ligaments are partially torn. Like if this is a ligament and some fibers are torn like this. Like this is what I have actually. I have my lateral collateral sprain. So what happened here is overstretching, and not the whole thing is cut, but some fibers got detached, got cut. So rest, and it will take weeks, but it should rejoin. Tendons, we talked about this. This is the attachment of the muscle to the bone, which is different than ligaments, which is bone to bone. How about the bursae? Again, these are small pockets of synovial fluid to act as a cushion between all these joint structures. What is making our joint stable? All what we talked about. Ligaments attaching bones to bones, tendons attaching muscle to bones and passing over the joint. So it stabilizes it. You have also the menisci, you have the muscles, you have the fat pads. All of these are stabilization factors. Now, the types of movements in the joints are different, but we are talking about the synovial joint specifically. Do you think synovial joint, is uh, synarthrosis, amphiarthrosis, or diarthrosis? What do you guys think? Synovial joint, synarthrosis, amphiarthrosis, diarthrosis. Which one? It's diarthrosis. It's diarthrosis. What syn means? Fixed or immovable. Of course, that's not the synovial joint. Synovial joint are all these joints, right? Amphi means slightly. This is not slightly, right? This is free movement. You can do like this. Amphi will be something like this joint here. You can barely, just a very tiny bit. But if you can do like this is free. So this is diarthrosis. Now, planes of movement, it can be as follows. If you go in one plane only, look at my elbow, I can do this and this. This is one plane only, okay? This is called flexion extension. When the angle of the joint gets smaller, 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 you're bending. We call that flexion. And the opposite is extension. One plane only, flexion extension. We call that monoaxial. What is if one like this? Flexion extension, adduction, abduction. Add meaning you're moving in. Ab, you're moving out. To remember it. Add, look at this. Add, you're adding to the body, closer to the body. Abduction, you're abducting away from the body. This is just to help you remember, okay? Adduction, moving toward the body, adding to the body. Abduction, you're abducting away from the body, okay? So look at this again, flexion, extension. This is one plane, right? Adduction, abduction, this is two. This is biaxial. The last one is the shoulder and hip. And look at this. Here is abduction, adduction. Here is flexion. Here is extension. Here is rotation and circumduction. All types of movements. Only shoulder and hip. Triaxial. Three axis. The movements can be angular, which is the one that I just talked about. Synovial joints. Look at this angle. This is straight, 180. And this angle will be like 150, 90, 60, right? You're reducing the angle or increasing the angle, flexion, extension. This is called angular, and this is the vast majority. However, there are other types of movements of the joints, including gliding. When you glide something, it's just like this. This is gliding. You glide. You can do circumduction. Circumduction is this. If you draw a circle, is circumduction. Rotation is this, around the axis. You see the difference between rotation and circumduction? If you rotate around the axis like this is called rotation. This is called circumduction. These are two different movements, right? The shoulder and the hip joints, they do all of them, everything. I can do rotation, I can do circumduction, I can do flexion, extension, abduction, adduction, rotation, circumduction. It's everything. It's triaxial. And then there are some special movements. So if you look at this one right here, if you draw something like this using a pencil, this is called gliding. If you move it like this is linear in one line. If you change the angle, this is called angular movement. If you do like this, circumduction, look at this movement here. Rotation is around the axis, as I mentioned. And here is the shoulder joint. You can do different types of movements, so it's triaxial. Okay, For those, I will ask you about the examples. What does it mean? An example. Gliding, gliding. Okay, you're moving flat. And the example is carpal bones. Do you guys remember the 8 carpal bones and the 7 tarsal bones? These short bones, they are just like this. They move like this. If I move this, they are actually gliding on each other. So you do need to know the examples. This is usually the question. What does it mean? And give me example. Angular. This is the easy one. Angular is it's all these joints. Any synovial joint is angular. What's a synovial joint? In between each 2 long bones. Clear? All these well-known joints, these are synovial joints at the end of any 2 long bones. This is angular, of course. What kind of movements? You can do different movements. Flexion is this, decreasing the angle. Between what? Between this and this. Between the arm and the forearm. There is an angle here at the elbow, right? You decrease the angle, 180, right? 150, 190, 60, 30, right? Reducing the angle. This is called flexion. The opposite is increasing the angle, right? 90, 100, 150 until you go 180. Can I go beyond that in this joint? No, but I can in this. Look, flexion, extension. How about this? Going beyond the straight line, hyperextension. Hyperextension, which is extension beyond the normal 180 straight line. Look at your neck. I can do flexion, extension. That's it? No, I can do hyperextension. How about this? I can do flexion, extension, but I can do hyperextension, exceeding the 180. We call that hyperextension. So flexion, extension, hyperextension. Okay, like this. Flexion, extension, you go back. Hyperextension, you exceed it. This one here, flexion, extension. Extension is straight line. You go until straight line like this. What if I continue passing it? Hyperextension. Abduction and adduction, again, if you move anything away, always think about it this way. Here is the axis of the body. This is the longitudinal line, the axis of the body, the metal line. You move anything toward the metal line, you're adding adduction. You move away, you're abducting away from the metal line. Adduction and abduction. So what do you guys think about this? Abduction and this? How about this? My lower lip. Ab and this? How about this? Abduction and this? So middle line toward the middle line, add to the middle line is adduction, away from the middle line is abduction. So here it is. Move away, abducting away is abduction, moving in is adduction. Here it is. Where is my middle line? This middle finger here. This is abduction and this is adduction. Circumduction again is, it's not rotation. Circumduction is not rotation. I'm not rotating. No, I draw a circle without rotation, complete circle, like this. Circumduction. Rotation. Rotation is basically around the axis. It's around the axis of the of the limb, and it goes like this. What is the axis of this? In the middle, right? So look what I'm going to do. Rotation, right? I can rotate my lower limb. In, out, in, out. It's not this. I'm not moving. It's just around the axis. Rotation is around the axis, okay? So this is called rotation. But if the rotation will end up moving toward the body, we call it medial rotation. And if it is away, it's called lateral rotation. And look at this. If I'm standing up in an anatomical position like this, rotation, look at my thumb, moving in, right? Toward the middle line, medial rotation. Look at this, lateral rotation. Medial rotation, lateral rotation. Look at this, medial rotation, lateral rotation. You move in, it's medial, toward the middle line, medial. You move out, lateral rotation. How about this? This is lateral rotation, right? And this lateral rotation. So if in this case specifically, because it's the middle line, we say right and left lateral rotations. This is for rotation. Pronation and supination, this is something specific for your hand. Pronation and supination. Do you guys know the prone position and supine position? Prone position is face down, right? Simply consider your palm is the face of your hand, and this is the back of your hand. So look at this movement. I'm not talking about rotation. Rotation is the whole arm, all of this. I'm not moving this. Look at my forearm and my hand, okay? This is not moving, not the whole arm, not the whole upper limb, look. So if you look at this, face down. What's the face down? Pronation. Look at this. Face up. Supination. This is something unique for your hand. Pronation, supination, without moving this. If I move the whole thing, this is rotation. Did you get the idea? The whole upper limb from the shoulder. If the movement is in the shoulder, this is medial rotation, lateral rotation. But if you're moving the forearm and the hand only, it's medial and lateral rotation. Okay? So supination and pronation is something unique for pronation and supination, unique for the hands. Here is pronation and supination. Other movements: inversion, eversion, dorsiflexion, plantar flexion. These are special things for the foot. And inversion, if you move the foot inversion. Look at this movement, look at my foot on. If I go like this, you see how the sole is facing inversion. Look at this, it's facing out, eversion, E, X, N, inside. See these movements? Inversion, eversion. The other thing is dorsiflexion, plantar flexion. If you look at my wrist, this is flexion and this is extension, right? You cannot do that with your foot because your foot will never be straight, right? It's always, there is an angle like this. So, and actually the flexion is like the opposite. Here is the flexion is palm, right? Like this, and this is extension in the back. How about this? This is you extending like the back. So they got confused about that. What should we call it? Like, this is flexion, but this is the back. Maybe this is flexion, but it's increasing the angle. What should we do now? They ended up calling both of them flexion, but dorsi and plantar flexion. This is dorsiflexion, flexion of the dorsum of the foot, and this is plantar flexion. Okay? Just because of this issue that you cannot get your foot straight. This is inversion and eversion, plantar flexion, and dorsiflexion. Other movements, opposition is this. Fingers opposing each other. Fingers, opposition. Opposition, reposition. Opposition, reposition. The opposite of opposition. Protraction and retraction. When you protraction means protruding. Protraction like this. If I push my mandible forward, it's protruding. If I get it back, this is retraction. Protraction, retraction. Moving forwards and backwards. protrude your mandible or your jaw and retract your jaw. You pull it back. This is opposition. This is protraction and retraction. Elevation, depression. This is something like your scapula in the back here. I can elevate the scapula and I can depress it. This is moving up and down. It's none of what I talked about before. It's just moving up, moving down, right? Elevation and depression. Lateral flexion is just what I talked about, because what do you want to call it? Like this is flexion and this is flexion. Which one is medial and which one is lateral? There is no medial. Lateral flexion, both of them. So here is elevation, depression, moving up, moving down. Lateral flexion, both ways, both the neck and the trunk. Now the synovial joint can be also classified according to how the two bones fit with each other. Sometimes it is gliding, both bones are flat, like this, like your wrist. Here is a bone, and they move like this. This is called gliding. We have hinge, condylar, saddle pivot, ball and socket. And for each one of those, you need to know also examples. What does it mean and examples? So plane joint, gliding joint. This is when you have this one movement of gliding like this. You glide. Hinge is an angular movement with a single plane. This is a hinge. Look. This is an angular? Angular, right? Here is the angle. And one axis only. Flexion, extension, that's it. There is nothing else. We call this hinge joint, and I will show you the pictures. Condylar is when you have a condyle. You guys remember the condyle? That's this elevation with smooth surface, medial condyle, lateral condyle. So this will give you usually a biaxial movement, but I will show you the picture anyway with examples because this is something that you need to know. Here is the gliding. What's the example? Carpal bones. Also, this joint between the lateral end, the medial end of the clavicle, I mean, and the manubrium. It's like this. So it glides. Okay, examples here are important. What does it mean? Plus examples. Clear. Hinge. Here is a hinge. Hinge is like this. Do you guys remember the ulna with the trochlea? Remember this joint? Yes, this is exactly the hinge joint. And what does it allow? Just one axis only, monoaxial. And the best example is this joint. What is the other joint that also have monoaxis? What do you think? Just like flexion and extension. The knee, yes. Try to move your knee. It might give you a very tiny, like lateral, a little bit, but it doesn't count. It counts as one of these examples, which is the hinge joint, just like this. So elbow and knee are good examples. Condylar is when you have a condyle, which is something like this. Something riding something, condyle. And the example here is radiocarpal joint. This joint here between the radius and the carpus. And also the metacarpophalangeal joint. This is another example. Saddle is like you're riding a horse, like the saddle horse, okay? And the saddle will be biaxial. Pivots, I talked about that. It allows rotation. Ball and socket. Do you remember the ball and socket? What are the examples in the skeleton that we did? Humerus, the head of the humerus specifically with glenoid cavity. What's the other ball and socket? The head of the femur and acetabulum, right? Do you remember the acetabulum? The head of the femur fits in. ball and socket. This is an angular movement. It's biaxial, like carpal-metacarpal joints. Rotation. Rotation. Do you guys remember C1 and C2? Atlas and axis. Remember the dents, that extra body? And if you put C1 around it, it will rotate around it like this, which is this movement. Okay? When you do this movement, it's C1 and C2. Okay? Here it is. C1 above, C2, and they rotate like this. So this is a good example of rotation. Angular movement that allow rotation, circumduction, and all the different movements. Obviously, this is the shoulder joint and the hip joint. Those two are ball and socket, and they allow all types of movements. Angular, circumduction, rotation, it's triaxial. Intervertebral joints. Here is another joint. What's a joint? Simply, when we started in the beginning, any two bones coming together, right? Any two bones, irrespective of what in between the bones, it counts as a joint. So here we have this vertebra, let's say this is T5, and this is T6, and there is a disc in between, right? So this is a joint in between those two vertebra, and this will allow slight movement. For this joint specifically, there are two things that we need to know about this specific disc, intervertebral disc. I think we heard about herniated disc. Did you hear about this herniated disc or disc prolapse? If we hear about it, yes. The disc itself is two parts. There is annulus fibrosus, which is outside. Like if you look at the disc, let's say this is one vertebra, disc, one vertebra. Okay. The disc itself, there is a nucleus inside. We call it nucleus pulposus. Nucleus pulposus, and the surrounding is called annulus fibrosus. Sometimes this whole disc goes out. Sometimes only the inside leave like this, protrude out. These are two different conditions. It's not the same. So annulus fibrosus and nucleus pulposus. If it's the annual fibrosis, we call it bulging disc. It's not the same. The whole disc is bulging, okay, including the outside. If the annulus fibrosis only, I mean the nucleus pulposus, I'm sorry, if the nucleus is going out, we call that herniated disc. Did you get the difference between those two? These are two different conditions, not the same. You can't say the disc is going out. What do you mean? You mean the whole thing, disc going out, like disc prolapse or bulging disc? Or do you mean only the nucleus inside of it? It can happen that only the nucleus protrude out. If the nucleus only, we call it herniated disc. If the whole disc is bulging, it's usually push on the spinal cord because it's the whole disc going out. The spinal cord is behind it. But if only the nucleus is protruding out, most of the time it presses on a nerve, not the spinal cord itself, because it goes to the side. Look at this picture here. This is a normal intervertebral disc. This is bulging disc. This is normal. This is bulging disc. And look at this one right here. See how the nucleus is going out? And because it's going out, it presses on the nerves, on the spinal nerves. This is the spinal cord. It usually does not press on the spinal cord because it goes to the sides. If it goes backward, this is going to press on the spinal cord. Okay, now there are ligaments that are holding these vertebrae to each other for stabilization. The first one is called ligamentum flavum, and this is holding or connecting the laminae. Do you remember the lamina? The pedicle and lamina, do you know this? It's in your exam. The pedicle connecting the body to the transverse, and then yes, it's connecting all of these together. The next one is posterior longitudinal ligament, and this is one connecting the posterior surface of the bodies. Just get the bodies together, connecting them together. Anterior longitudinal, same thing, but from the front, anterior of the body. Look at these. This is anterior longitudinal, this is a posterior longitudinal, and ligamentum flavum is just connecting uh, the lamina together. Interspinous ligament connecting the spines. Supraspinous ligament is connecting spinous processes C7 to the sacrum, and it's just the upper parts. It goes like this. From C1 all the way down, every one of those except C1, C2 actually. So from C2, each one of those is having a spine, right? Remember that spinous process? All of these are connected, okay? 2 with 3, 3 with 4, 4 with 5, and so on. These are all connected, okay? And we divided into this part in the neck from 2 or from 1 to 7. This is called ligamentum nuchae. What does it mean? Ligamentum, ligament. Nuchae, neck. This is the ligament in the neck. And the rest is just interspinous ligaments. So here are the ligaments, the different types of ligaments. And this joint can move. If you forgot it, just try it. What can I move? I can do this, flexion. I can go back, extension. I can do lateral rotation, and I can do, lateral flexion like this, and rotation. You can try the different movements and you'll see it. Elbow joint is hinge. You do need to know this. Which of the following is an example of hinge joint? For example, elbow. And the elbow joint is 2 parts. Remember, you have humerus that make a joint with 2 bones, isn't it? Do you remember this? Humerus, and there is ulna and radius. The humerus make 2 joints, not 1. It's 2 in 1. Humerus with the ulna, humerus with the radius. But which with which? And this, in your exam, I talked about it. Which part of the humerus with which part of the ulna? What is it? Ulna. Trochlea with trochlear notch. How about the other side? Radius, capitulum with the upper surface of the head, of the radius. Do you remember that circle? The top part of it. Remember, from each one of those joints, I will ask you how the joint is made. What with what? Not humerus with ulna and radius. Not enough. Which part of the ulna? Which part of the humerus? Which part of the radius? Which part of the humerus? You will see questions like these. Besides the type of joint, is it hinge joint like this? Hinge like this? It's not ball and socket. Ball and socket like a socket, a big socket like this, like half a sphere, half spherical structure, and there is a ball fits into it. But this is different. This is like this. Hinge. There are several ligaments here, but I'm not going to ask you about the ligaments here because it's just the ligaments have the names of the parts connected. And I'm not going to focus much on this. The one that I'm going to ask you in details is the knee, and I mentioned it, okay? Details in the knee. Others, how about everything else? Everything else, you need to tell me what kind of joints, movements, and which part fits with which part. That's it. Clear? If I ask you about anything, shoulder joint, Yes. What kind of joint? This is ball and socket. What kind of movement? Angular triaxial. What are the parts? Glenoid cavity with the head. Done. Okay? This is not for the knee. Everything in the knee, we should know it. Just understand that there are several ligaments connecting the two bones, or the three bones in this case. Knee joint. This is a hinge joint, but it's complex. And it's basically between the medial and lateral condyle. Do we remember this? This is if you are preparing or if you took the exam already, you should know this. Remember the medial condyle and lateral condyle of the femur and medial and lateral condyle of the tibia, how they fit together. Yes, it is kind of two parts of it, plus patella. The patella is a bone, isn't it? It participates in the joint, not the fibula, right? Fibula have a joint with what? Have two joints with what? Fibula. What kind of what does it articulate with? With what? Tibia. Yes. The fibula articulates with the tibia. Does the fibula articulate with the knee? No, just with the tibia. There are two joints like this. Okay? They articulate with each other. But fibula is not part of the knee joint. Menisci, generally speaking, I told about the menisci. Menisci are intra-articular cartilage. It's additional cartilage inside the joint. Is it the same as articular cartilage? Is it? It's not the same. Articular cartilage is with the bone. It's the outer surface of the bone to make it smooth. But this is an additional cartilage in between those two. For the knee joint, there are many things that we need to know. There are several ligaments involved, and these ligaments are anterior ligament, posterior ligament. This is the first thing. Anterior ligament is basically this muscle here. We will do the muscles next time, but this muscle here is called quadriceps. Quadriceps. The tendon of quadriceps, which is this part down here, and the knee, goes all the way to be inserted into the tibial tuberosity. Remember this tibial tuberosity? It's inserted there. So this is the whole thing here is a tendon, but patella formed within that tendon. So what do we call the patella? What kind of bone? Sesamoid bone. Yes, sesamoid bone. All right. But now you're dividing this tendon into two parts: part before the patella and part after the patella. The one that's after the patella, we call it the patellar ligament. This is another name for it. And then we have two ligaments in the back. I will show you the pictures. Two in the sides and two inside. Look at this. This is the quadriceps tendon. Okay? It should start from here. Look. Follow, 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 follow. It goes all the way to be inserted here in the tibial tuberosity, right here. But the patella formed inside. It's a bone that formed inside, sesamoid bone. So now you're dividing it into two parts. The lower part is called the patellar ligament. Okay? Here is the medial condyle. Here is the lateral condyle of the femur. Here is the medial condyle. Here is the lateral condyle of the tibia. Now look inside. Do you see those two crossing each other? Can we see this in the middle? They are crossing like this. One of them is crossing in the front. You can see it more in the front. And the other one is crossing from the back. This is anterior cruciate ligament and posterior cruciate ligament, also known as ACL and PCL. Okay? If you're playing sports or something and you hear about something like this is the ACL and this is the ACL because I'm in the front. How did I know that this is ACL right here? Because this is the tibial tuberosity, remember? The tibial tuberosity in the front. You remember that? If you wanted to know right from left, it's in the front. So I'm looking in the front. This is crossing from the front. This is the ACL, and behind it, crossing it from behind, this is the PCL, or posterior cruciate ligament. Look at the menisci. Here is one medial and lateral menisci. Extra cartilage in between the bones. And then we have one ligament, medial, lateral, and the other one, medial in the side, and one is lateral in the side. Here is medial and here is lateral. These are the medial and lateral collateral ligaments. What is that? Which bone of the leg is medial and which one is lateral? Tibia is medial and fibula is lateral. So if I have a ligament that is connecting the femur with the fibula, would that be the lateral or the medial? Lateral. And if I have another ligament connecting the femur to the tibia, medial collateral ligament. Medial collateral ligament and lateral collateral ligament. This is what I have actually from playing. I have the lateral collateral ligament. This one here is sprained, partially torn. So basically it's this one here. It's not like completely cut, partially, a good part of it. And actually, if I wanted to move, my knee can move actually out a little bit because of this ligament was holding the bones together. Medial and lateral collateral ligament. The medial collateral ligament is also known as tibial ligament, tibial collateral. Why? Because it's medial connecting femur to tibia, tibial collateral. How about the lateral? Connect the femur to fibula, fibular collateral. Okay, tibial collateral, fibular collateral, which is medial. It's more known as MCL and LCL. Okay, so we talked about the knee joint in two parts. Part of it in the beginning, remember all these fat pads and bursae, synovial fluid, synovial membrane, and capsule. Do you guys remember all of this? The bursae and all these structures, plus what we just mentioned. So everything about the knee is something that you need to know. Otherwise, I told you what to expect. Shoulder joint, what are you expecting? Number one, what kind of joint? Ball and socket, angular. What are the components? Head of the humerus, glenoid cavity of the scapula, isn't it? What kind of movements? Triaxial, diarthrosis. That's it. By the way, this joint here is the most commonly dislocated joint in the whole entire body. Because even though it's ball and socket, but it's not a really deep socket, it's superficial socket. Compared to the acetabulum, remember how the acetabulum looks like? It was too deep. And the head of the femur is like going inside, very hard to dislocate. But here, the head of the humerus is going into this shallow glenoid cavity. Even though there is something called labrum, like lips, to make it a little bit deeper, still not deep enough. Especially that you move it in all directions. The more movements, the more chance to dislocate. Clear? So this is the most commonly dislocated joint in the body, shoulder joint. Glenoid cavity with the head of the humerus, but there is a glenoid labrum. Labrum means lips, just like the lips. And instead of being like this, it will be like this. There are lips, just to make it a little bit deeper. Here are the ligaments. I'm not going to ask you about it, but know that it's all about the parts that are connected. If you're connecting the acromion to the humerus, you call it acromio-humeral, and so on. But I'm not going to worry much. I'm not going to worry much about that. Separation of the shoulder, it can be partial or complete, dislocation. So there are two terms here. If you're telling me that the head of the humerus is coming out, is it coming out a little bit, or is it coming out completely? If it's coming out a little bit, this is called subluxation. If it is going out, so you have to put it back in, this is called dislocation. It's not the same. Okay, subluxation and dislocation is not the same. Subluxation is partial dislocation. Partial dislocation. Rotator cuff muscles, these are all these muscles around the shoulder. And there are different bursae. I wouldn't ask you about the details, just understand what's the bursa in the first place. Okay, not each one of those, that will be kind of too much. But the rotator cuff are these muscles surrounding the shoulder. Three of them are around the scapula, and one is called teres minor. We will see it more when we do the muscles. So look at all these ligaments. This obviously here, glenoid cavity. This is the head of the humerus. What is this? The blue. This is a cartilage adherent to the head. What do you call it? Huh? Articular, yes. Articular cartilage. The one that's adherent to the bone is called articular. Others are not adherent. Like meniscus, this is a separate cartilage. It's not part of it. Here is a glenoid cavity, and there is a labrum, just to make it deeper. Hip joint, same thing, same questions. What kind of joint? Ball and socket, angular. Is it diarthrosis, amphiarthrosis, or synarthrosis? Diarthrosis. Are you guys following? Do you remember this? It's diarthrosis, angular, ball and socket. What are the two components? Don't tell me it's the femur and the hip. Not enough. Head of the femur with acetabulum, to be specific. Okay? There are several ligaments connecting the different parts of the bones that I'm not going to spend much time in that. I told you the most important. Degenerative changes. Degeneration is wear and tear. When you use something a lot, especially if you are playing sports, even more especially if these sports are tough sports like football and soccer, you are more prone to the wear and tear, and you will get into these degenerative changes. Degenerative. So there is something called rheumatism, and rheumatism is a general term that describes pain and stiffness in general. At any joint, when you have pain and stiffness, I call it rheumatism. Arthritis. What's arth? A-R-T-H. Arth. Or arthro. What does it mean? Huh? Somebody said it. Joint. Itis. I-T-I-S. Inflammation. Arthritis, inflammation of the joint. Okay? Like osteoarthritis. But I told you guys before that osteoarthritis, like inflammation of the knee, it's more of a wear and tear. It's not, the inflammation is something that results from that friction. So it's not really infection or inflammation. It is, the new name is DJD. They call it degenerative joint disease. They say, yes, there is inflammation, but it started as friction. Okay, the cartilage is being like, it wears off. So now there is more friction, and that friction will cause degeneration, and this will be followed by inflammation. The other two things are rheumatoid arthritis and gouty arthritis. Let me explain it. You're not going in depth, just understand the idea. Osteoarthritis is wear and tear, degeneration. Okay? Rheumatoid arthritis is something that's completely different. It is also inflammation will happen anyway, But this is autoimmune response. What's the autoimmune response? If you guys still remember when we talked about how the immune system is introduced to all different types of cells in your body, your immune system know every single cell by the antigen on it, right? So if the immune system is like white blood cells going around, so it will find the liver cells. Remember it. I know this is my liver cells. Leave it alone. This is my skin cells. Leave it alone. This is my joint cells. Leave it alone. Autoimmune, simply, in simple words, is you forgot. You got confused. You lost the memory. Do you lose the memory like all cells? No. It's usually one or two or maybe three. Okay? So you forgot, like in this example, rheumatoid arthritis, you forgot that these cells inside the joint is your own cells, right? If it is programmed, uh, when I see something, I will run through my memory. What is this? Yeah, this is my cells. Leave it alone. What is this? Myself. Leave it alone. Self, self, self. And then I see this cells inside the joint. What is this? I run through my memory. I don't know what is this. I forgot it. So I'm going to attack. This is foreign. It's not foreign. Yes, it's getting crazy. It's getting losing the memory, forgetting, whatever it is. But it attacks your own cells. Gouty arthritis, on the other hand, is extra amount of uric acid that leave the bloodstream and go to deposit in the joints, starting this inflammatory reaction. And they used to call it the royal family disease, the king's disease. Did you hear about this? King's disease, disease of kings, disease of the royal family. Did you ever hear about something like that? Um, like during that time when they gave it the name, like most people on earth were really poor, but the royal families and kings and all these people, they are extremely rich. So they eat meat all the time. The ordinary people, they barely eat it. Okay? So when you eat more red meat, the end product that come from them is uric acid. If you're eating too much, it's beyond your kidney to get rid of it. So guess what? It leaves the blood and go to the joints, starting inflammation, and we call that gout. The other thing is if you don't move a joint, you're going to lose the mobility of that joint. And this is like if you're injured and you completely don't move, like in my case, I got my LCL injured. If I don't move at all, the joint mobility will decrease. It can go to the extent of I can barely move it. So there should be a continuous passive motion at least. If I go to the physiotherapist, he will passive means you are not the one who's doing it. So he will get my leg like this and start to do like movements. So we call those passive movements. This is the minimum that is needed to prevent immobility. And and on the other hand, what's the function of the synovial fluid? Lubrication and cushion. But what's the most important one? Why do we have synovial fluid inside the joint? This is lubrication, making the movement easier. Nu- Nutrition, nutrition and oxygen. Remember the cartilage is it vascular or avascular? Avascular. How can you get your nutrients? From the synovial fluid. Okay, are we following? Synovial fluid. So synovial fluid is secreted, loaded with nutrients and oxygen. It gives the cartilage and the joint what they need, and then it drains out. And then you recycle, secreted, loaded with oxygen and nutrients, and then drains. Continuous movement. The more you move, the faster this cycle goes. So what do you think will happen if you don't move? This will be very slow. Less nutrients, less oxygen. Other things are like um, remodeling, and I talked about this before, which is the balance between osteoclast and osteoblast. If the osteoclast take the upper hand, the bone mass will be lost. Okay. Integration with other systems. Okay.